Though passing the NCLEX is a priority for nursing students as well as nurse educators, how well prepared do you feel as a student for the challenges you will soon experience after the NCLEX? Will you be able to readily use and apply knowledge to the bedside? Will you be able to multitask, manage competing priorities, and time manage with multiple patients? Because no longer will you have just 1 to 2 patients, as you did in most of your clinicals in nursing education, but you'll have 4 to 6 in acute care and even double that in other settings. Therefore, most new nurses experience high levels of fear, and there's even a term the literature calls reality shock for this reality and experience. Most students fear that they don't have what it takes, fear that they might miss something, fear that they may hurt or even kill their patients. And unfortunately, that can happen when a nurse is unable to clinically reason and recognize a change of status until it is too late. So I want you to face your fears with a written mentor. Every new nurse needs a mentor to guide and smooth the often bumpy transition from nursing school to clinical practice. Think Yoda from Star Wars. And I would like to be that mentor. And I've written a book, a resource for you titled Think Like a Nurse, Practical Preparation for Professional Practice. That is really the essence of my heart and my passion as a nurse of 30 plus years, as well as a relatively newer nurse educator, and contains what I have shared with my students. I have put it in writing so you can have access to my thoughts and strengthen your practice as a result. But my book is not just a traditional textbook. It's written in a casual first-person narrative that emphasizes application of content, not just content for content's sake. My perspectives are backed up not just by my thoughts, but by 200 plus citations and references from the nursing literature. I have it available in 3 formats. First, the traditional paper textbook of 300 plus pages. I also have an electronic PDF ebook, as well as even an audio book that you can redeem your commuting time and that downtime by listening to a chapter as a podcast at a time. My content of 16 chapters is divided into 4 parts. Part 1 is ideal for pre-nursing and first-year students. I say, is nursing for you? Looking at the reflections of the essence of what it's required to be a professional nurse and how to thrive and not merely survive as a student. Academia is very stressful. Practice is more difficult and stressful, but also school is difficult. What are some practical tools to help smooth that reality and be successful? In part 2, it's called Get Ready, Preparing for Practice. This is ideal for first-year students, and I share why the art of nursing is foundational to practice. Caring, compassion, nurse presence, seeing the big picture of your patient, not just the physical needs, but their emotional and spiritual needs. How to act like a professional, which you are as a student nurse. Pharmacology content that must be mastered. Fluid and electrolyte that must be mastered as it relates to lab values, as well as essential concepts. Part 3 is titled Get Set, Essentials of Clinical Practice. This is ideal for advanced students. This gets into the thinking of clinical reasoning. Now that we have knowledge that we can use and apply, how does the nurse now think like a nurse? Using nursing process, clinical reasoning, critical thinking, and pattern recognition. I also shared my pearls of practice relating to how do I priority set and manage my time as a nurse in the clinical setting with multiple patients. I share those strategies with you. In part 4, Go, starting your nursing career. This is ideal for advanced students. I talk about some principles of passing the NCLEX, how to get your first position, how to interview well, how to really promote yourself as a professional graduate student, as well as words of wisdom from healthcare professionals. I work in a large metropolitan hospital here in the Twin Cities, and I surveyed and asked many of the physicians, nurse practitioners, and nurses in practice what would be their word of wisdom to a new nurse just starting on their journey. They shared them with me, and my book is the only place that you'll find them. If you're a student, you've already invested thousands of dollars in your nursing education. For just a fraction of what you've already spent, you can make a similar investment in transitioning successfully to real-world clinical practice. Your journey is about to begin, and you need to focus on how life will look after the NCLEX. But if you want to do something different, and be somewhere different than where you are today, you have to do something different. I want you to take that first step toward a different future today. So don't run from your fears, but face them directly by utilizing my book that will strengthen your ability to think like a nurse and become better prepared for professional practice. Thank you.